Hello guys, welcome back to my channel, and this video is going to be about the anatomy of the skull. I'll be explaining the skull externally as well as internally. The way I'll approach is first we'll start on with the external skull and then to the internal skull. The way I'll be explaining the external skull is through different views, that is the superior view, the lateral view, the anterior view, the posterior view and the inferior view. I'll be creating different videos for each view and then similarly moving on to the internal skull. So without wasting any more time, let's begin. This is the superior view of the skull, or in Latin it is known as Norma Verticalis. So before we begin, the skeleton of the head is called the skull, and it has several bones that are joined together to form the cranium. The terms skull and cranium, they are often used synonymously. The skull, it can be divided into two main parts, the calvaria or the brain box and the facial skeleton. When we look at the skull from this view, it is usually oval in shape and it is wider posteriorly. This is the posterior part and that is the anterior part. It is a bit wide posteriorly than anteriorly. The bones that we can identify from this view are: anteriorly we can see the upper part of the frontal bone, and posterior to the frontal bone we can identify parietal bones. These are the parietal bones, and posterior to the parietal bones we can see the uppermost part of the occipital bone. This is the uppermost part of the occipital bone. These bones, they are joined by sutures. These are the joints of these bones and are known as sutures. So first of all, the most anterior suture right here, as you can see here, this is the suture right here. This is known as the coronal suture. This coronal suture, it separates the frontal bone from the parietal bones. This is the coronal suture right here, and it separates the frontal bone from the parietal bones. Then posterior to the coronal suture we have this long median suture, and this is known as the sagittal suture. It is separating the two parietal bones. As you can see, these parietal bones, they are separated by this median sagittal suture. Then posterior to the sagittal suture, the suture right here, as you can see, this suture, it is known as the Lambdoid Suture. It lies posteriorly between the occipital bone, this is the occipital bone, and these are the parietal bones. So the Lambdoid suture, it separates the occipital bone from the parietal bones. Now in some individuals, around 3 to 8% of the individuals, they also have another suture that is known as Metopic suture. It lies in the median plane and it separates the two halves of the frontal bone. This suture, this Metopic suture, it usually fuses at 6 years of age. Some other identification features that we can identify from the superior view of the skull are, first of all, the vertex. Vertex is the highest point on the sagittal suture, and for this skull, the vertex would be right here. As the vertex, it most commonly it lies in the center of the sagittal suture, and as you can see, this is the most elevated portion in the sagittal suture, and this is our vertex. The next feature is the Bregma, the point where the coronal suture and the sagittal suture meet, that is right here. This is the point, this one where the coronal suture it meets the sagittal suture, and it is known as the Bregma. Now in the fetal skull, this side is actually a membranous gap, and it is known as the anterior fontanelle. This anterior fontanelle, it closes or it fuses at around the 18 months of age, and it allows the growth of the brain. the point where the sagittal suture right here, it is meeting the lambdoid suture and is known as the lambda. Moving on to the next part, that is the parietal tubor or parietal eminence. This is the area of maximum convexity on the parietal bone. So how to identify? Well, this is the parietal bone and the maximum area of convexity is this. So this will be the parietal tubor. Similarly, on the other side, as this is the parietal bone and the area of maximum convexity is right here, and this will be the parietal eminence for this skull. Moving on to the next part, that is the parietal foramen. As you can see right here, these are the parietal foramen, one on each side of the bone, and these parietal foramen, they transmit an emissary vein from the veins of the scalp into the superior sagittal sinus. Once again, these parietal foramen, they transmit the emissary vein from the veins of scalp into the superior sagittal sinus, and the point between these two foramina right here, it is known as the Obelion. And if you are getting confused, what is this? These are just some screws in the model, because this is a model of the skull. In some cases, the anterior fontanelle, it starts bulging. That is a result of increased intracranial pressure. And when the anterior fontanelle, when it is depressed, that is a result of decreased intracranial pressure due to dehydration. And during the vaginal delivery, the bones, they override at the fontanelle. That helps in the procedure of childbirth. In some cases, the capillaries of the skull, they get ruptured, and that leads to swelling. That swelling is known as Caput succedaneum. That is in Latin, and the skull, it returns back to its normal shape within a few days. So that was all with the superior view of the skull. And if this video was helpful, do give the video a thumbs up. Also, if you are new to the channel, do subscribe to the channel so you do not miss on the later videos.